All right, welcome. When you're prepping for exams, you're not just studying topics. You're basically a detective profiling a villain. And today, we're building the ultimate rap sheet on one of the biggest bad guys in pediatric health, rotavirus.
So, let's start with a pop quiz. If you had to name the single biggest viral cause of that really severe, dehydrating diarrhea in children all over the world, what would you say? Yep, you probably guessed it. It's our target for today, rotavirus.
So here's our game plan for building this profile. First, we're going to meet the villain, get its proper ID. Then, we'll expose its attack plan and check out the damage report, what it actually does to the body. After that, we'll see how to crack the case in the lab and, of course, how we fight back. And we'll wrap it all up with a rapid-fire review to make sure this stuff sticks.
Okay, first things first in any investigation, you gotta know your target. So, who or what is rotavirus, really? Let's pull up its official profile.
Here's the core ID you absolutely have to remember. It's a non-enveloped, double-stranded RNA virus. And that double-stranded RNA part? That's a huge clue. You're going to want to circle that in your notes. It belongs to the Reoviridae family, and it is hands down the #1 cause of severe gastroenteritis in kids on a global scale.
And its key features? They're perfectly captured in this killer mnemonic ROTA. R is for its RNA genome. Remember, it's double-stranded and segmented. O is for being the only virus family with that dsRNA. T stands for its toughest nails, triple-layered capsid, which makes it super resilient. And A is for its appearance. It literally looks like a wheel under a microscope, which is exactly where it gets its name. Rota is just Latin for wheel.
Now, this is a super important distinction. Not all rotaviruses are created equal. Group A, that's the one we see all the time, causing that classic severe diarrhea in kids pretty much everywhere. But you also got to know about Group B. It's known for causing these huge severe outbreaks in adults, especially in places like China.
Okay, so now let's get into its modus operandi. How does this villain actually pull off its attack on the body?
Its attack plan follows 4 simple steps, and you can remember it with the mnemonic RIDE. First, it reaches the small intestine, usually through the fecal-oral route. Then, it invades the enterocytes. Those are the cells lining the gut. From there, it damages the cell's transport systems. And the final blow? It releases an enterotoxin, a nasty little protein called NSP4, that basically just opens the floodgates, causing that massive, watery secretory diarrhea.
So, what's the aftermath of this attack look like? Let's check out the damage report and see the clinical picture.
The symptoms hit fast and they hit hard, usually after a 1 to 3 day incubation period. To remember the key features for your exam, just think V, fad. It kicks off with V, vomiting, followed by F, fever, A, abdominal pain, and that signature watery diarrhea. It's so bad you can even think of it as very freaking awful diarrhea.
And to really wrap your head around the scale of this thing, just look at this number. This is not just a simple stomach bug. In India alone, rotavirus is responsible for an estimated 78,000 deaths and causes over 872,000 hospitalizations every single year. That's the kind of serious damage this villain can do.
Okay, so now you're the medical investigator. How do you prove rotavirus was at the scene of the crime? Let's talk lab diagnosis.
We've got a few tools in our kit, and you can remember them with the mnemonic EARS. We can use ELISA, or electron microscopy, to literally see its wheel shape. We can do antigen detection in the stool. We can use RT-PCR to find its genetic fingerprint. Or we can use serology to see a rise in antibodies.
But here's the crucial point. If an exam question asks for the best, most definitive test, the answer is RT-PCR. It is the gold standard. There's no question. It's the most sensitive and specific way we have to detect the viral RNA and lock in that diagnosis. So we've profiled the villain, we've confirmed its identity. Now, how do we fight back? Let's get into treatment and prevention.
This is so critical. There is no specific antiviral drug for rotavirus. Treatment is all about supportive care. The main goal is to manage the symptoms, and that means aggressive rehydration with oral fluids or an IV to replace all the water and electrolytes that have been lost.
Of course, the best fight is the one you don't even have to have, right? So prevention is everything. And for that, just remember WASH and VAX. WASH stands for improved water, sanitation, and hygiene. And VAX? Well, that's vaccination with live attenuated oral vaccines. Now, when it comes to vaccines, there are 2 main players on the field, Rotavac and Rotarix.
They target slightly different strains, but the key difference for your exams is the schedule. Rotavirus is a 3-dose series, and it's the one that's integrated into India's national immunization schedule. Rotavirus, on the other hand, gets the job done in just 2 doses.
All right, team, let's lock all this information in. It's time for a rapid-fire review of the most high-yield points you absolutely need to know.
And there it is, your ultimate cheat sheet for rotavirus. Seriously, screenshot this, write it down, do whatever you need to do. We've got the etiology, pathogenesis, clinical features, diagnosis, and prevention all summarized with their key facts and those handy mnemonics. This is pure exam gold right here.
And that's your complete villain profile on rotavirus. We've seen its identity, its methods, and our defenses. You know, it leaves us with a really important question for the future. As vaccination rates keep climbing, could we actually be on the verge of finally defeating this global villain for good? Something to think about.